Before passing over to Sarah, I wonder if I could just say just a couple of words. That so I'm very much an amateur in this game by comparison to you guys, but I've done a couple of trips actually with the foundation and with Richard Stanley to look at some of these road safety issues in different countries, and looking beneath all the technicalities, there are a couple of moments that have really stood out for me. One was actually when we went to a school in Kibera. And these were desperately poor kids in a horribly overcrowded classroom. I think about 30 kids in the classroom. And we asked them to put their hands up if they'd been involved in a road traffic injury. And half of the class put their hand up. And then we asked them if they'd lost a family member as a result of a road traffic injury. And I think something like 10 or 15%. I mean, it's really quite a significant number. They'd almost all been in these minibus crashes that happened between Nairobi and Kismayo. But on the same trip, actually, we went with a group of kids who were walking to school. And in order to get to school, you had to walk across the Nairobi-Mombasa highway, which is a 6-lane highway, with trucks coming from the port of Mombasa into Nairobi. And it's really one of the scariest. You see these 12-year-olds carrying 6-year-olds across the equivalent of the M1. And on the same trip, actually, we went and spoke to a whole bunch of transport planners, infrastructure planners, including the bank at that. This was a few years ago. Doubtless things have improved since. But I have to say, you would have to drag the words road safety out of them like pulling teeth. Because really, the paradigm is all around tarmac roads and journey times, and I do think we've got this development issue actually that we've got a sort of dominant way of thinking about the problem, which is how do you lower the cost of getting from point A to point B. In particular, how do you lower the cost of getting goods from point A to point B? And safety is this sort of afterthought that is bolted on. And I think the challenge that Mark and his colleagues are really rising to in the bank, and that you guys are tackling through the UN and others, is really to shift that way of thinking about the problem. Because if we continue to think about transport policy problems in that way, safety will never be more than an afterthought. So I think it's great that we're having this meeting, that this report will make a real contribution to that ongoing dialogue. So with that, I'm going to pass over to Sarah, who's very, very welcome to ODI.
Thank you very much. And apologies for being late. My role, I think, is simply to chair, hopefully, the discussion that you're all going to take part in. But maybe I could sort of lob a couple of questions from a complete amateur, because I haven't been involved in this apart from perhaps writing about that asthma and emissions report that was referred to just now. But I'd be very interested to know, and maybe we could just start with a couple of questions between the panel and then everybody else can come in. For instance, perhaps from you, Mark, at the World Bank, how, really following on from what Kevin was saying just now, the bank has obviously invested an awful lot of funds in road transport, in fact, as well as in health. How can you marry those things up, and why have we got actually to the point we're at, where there has been what looks like a lot of development of roads without any much thought to the health aspects?
Thank you, Sarah. So, again, sort of the prehistory at the beginning of the discussion was precisely a sort of a timeline perspective since 2004, in particular, how the international community has tried to, both at the UN level and at the development bank level, begin to recognize this issue, particularly around road traffic injuries, as a major health contributor to countries. But I think what we see across the board, and this is really to Saul's statement as well, is a systematic lack of understanding, both at the country level and in the past, to a certain extent, even within development banks, at the donor level, really across the board, about what is this idea behind what we discussed on safe systems approach, which essentially is marrying up a holistic approach between health, between urban planning, between transport. I think a lot of the difficulty with development and what we're seeing right now is just, again, this enormous complexity of the environments that people are trying to operate in, particularly operate in when you're seeing an issue like road safety be seen by governments as an add-on to, say, borrowing for a loan for road safety, or something that impairs from getting from point A to B quickly. And it's been our role, particularly through our program at the Global Road Safety Facility, to try to prepare new tools, to try to prepare new arguments for us to make at line agency level up to the prime ministerial level in some countries. And it's a difficult sell sometimes. You would like to be able to go into a Minister of Transport's office and say, how many lives do you want to kill on your roads this year? Now, ideally, the answer would be 0. First, if they're aware that they have a road safety problem in their country, and secondly, you would hope it would be 0. But there's not a lot of ability to set visionary targets for road safety and have them be implemented in a logical, sequenced way. So a lot of what we've done over the past few years, particularly through World Bank projects like the one in Argentina that Saul referred to, are find ways to go in and help countries understand where they are currently at in their road safety management system. And a lot of tools hadn't existed. The international consulting community prior to 2004, 2006 or so has gone into a lot of countries, and what we've had is what we call the Christmas tree approach. They say your country is lacking these 50 things for road safety, go and do it. Well, you're leaving them with no ability to necessarily understand how to systematically invest in a logical way. What needs to be done first? Most countries understand that speed, or most practitioners understand that speed is a problem. And they hear about helmet wearing, and they hear about drunk driving campaigns. Well, that's fine, but what about agency development? What about lead institutions to help actively manage this problem? So the safe system approach is about marrying up health, transport, urban planning, and we go in and we try to understand how can you logically create a project and have you, the country, manage it in a way where you can combine all of the elements around road safety, police, the post-crash care, the infrastructure safety. Do it in a targeted way where most of the death and injury is occurring on your network, and then look for a rollout. And the great thing is about development bank financing, we have the ability to go in and create these projects that last 2-3 years and show them a way forward in this. So again, this concept of safe system that Kavi and others referred to earlier is really about the future. The question is, how do we get it more systematically implemented in countries? And unfortunately for that, as Saul was just talking about, we need to almost incentivize countries with funding, what we call catalytic funding. And the donor community, by and large, has been absent from the field of road safety. And so we hope reports like this, which are part of a long series of reports that have come out raising the bar on road safety. But this is really a health check on where we are as a global commons around this area of road injury and emissions. It's only getting worse. And so if we can't help countries catalyze their investment around this, if we can't help countries build their internal capacity, we're not going to see an improvement.
Okay. There's a problem here around the status of the different ministries, isn't there, too, when health is actually a sometimes lower status. Anybody else want to come in on that, particularly?
Well, I can say one thing. I think it's very interesting the role that different sectors play, and health particularly, because I'm at a school of public health. That's what I think about most of the time. Health can play a dominant role in framing the problem as a development issue, and they haven't done that well enough yet. Transport can not frame it as a development issue. Health has a special status there. When it actually comes to implementing road safety, health's role is substantially smaller. What Mark's talking about in safe systems, it spans such a large number of fields that health is a relatively small part. And that small part is, for example, pre-hospital care and hospital care. So there's a nuance to how different sectors need to work together, which we've seen play out in many European countries, but not so much in developing countries yet.
Okay. What about, well, in fact, I can see some hands already, so I think we'll move to the floor. Sorry, I think the lady with no, this gentleman.
Thank you very much, Brendan Martin, Public World. I want to build on a couple of the points that Kevin made and relate them to a couple of the points that Mark made. Kevin referred to the Kibera example and the role of minibus taxis in causing many road crashes. And it seems to me that one of the aspects that is frequently left out of this discussion is the relationship between how people are employed and how their work is organised and the effects of their work, which is what Public World, my organisation, focuses on. And particularly in the context of the multi-sectoral approach that you were talking about, the holistic approach that you were talking about, Mark, it seems to me that we need a great deal more attention on this. I'm not aware of any research that has really tried to measure these relationships. And they clearly are relationships. When road haulage drivers are paid by the kilometre, well, you don't have to go to developing countries to see it. Every Londoner knows that one of our major hazards on roads is what we call white van man. And that's the usually very precariously employed drivers who are responsible for the last mile of our internet and other logistical services, internet shopping and other logistical services. And they're typically paid perhaps 50 pence per drop. So it seems to me that this is an area globally that we need to address more, that how the employment and work-related aspects fit in to the rest of the development priorities.
Anybody would like to comment on that? Yes, please, Aaron.
Well, only to reinforce it, I think in rapidly vehicularizing settings like Vietnam and other places, many people are making their living next to busy roads, in stores and selling things on the street, and so I would only second your concern that what we think of as environmental exposures for many people, many places are occupational.
Katie.
I just wanted to say that something that didn't come across in the report or our presentations today is that the Global Burden of Disease actually looks at occupation as a risk factor. So part of that is you could look at the visualization tools that I showed earlier online and see what proportion of premature death and disability occur as a result of occupational risks, and that translate into road injuries. So we don't have that broken down by profession at this moment, but it is taken into account when assessing the occupational risk of road transport deaths and disability.
I have a question from a lady over here.
Hello, Andrea Coleman from Riders for Health. One of the things I'm concerned about in the discussion is that in rural Africa, the problem really is to do with lack of vehicles. And of course, people are dying in huge numbers of easily preventable and curable disease because vehicles aren't available. And those that are available are very badly maintained. And a lot of donors and people who invest, who could be investing in vehicles, are not doing so because of some of the issues that you were all raising. So I'm just concerned that we don't, as it were, throw the baby out with the bathwater by making sure that we are saying that vehicles properly used and people who are trained to drive and ride the motorcycles or vehicles, the training and the maintenance of vehicles is hugely important in this. A well-maintained vehicle, a badly maintained vehicle has terrible dangers to them. But I think it's important that we don't say vehicles are a bad thing. We've got to say that we've got to think about how we run and manage them, because otherwise people are going to say we're not going to invest in vehicles for rural Africa and people are going to die of all sorts of things other than road accidents. So we've got to just be careful what we're saying, in my opinion.
Thank you. Any comments on that one? Yes, please. Oh, sorry. Do go ahead, Aaron.
Well, only to agree, and we were discussing this, I think, before the session started. I think what's important, I mean, I agree with you completely. I think what is important is to ensure that the cleanest engine technologies and fuels, as Saul mentioned, are globally available, not just in high-income countries, but everywhere, so that when your organization buys new diesel trucks or ambulances, for example, they can invest in the cleanest technologies possible and have access to the cleanest fuels that are necessary to make those technologies work. So I would just add that to what you said.
Saul, did you want to come in on that?
Just quickly, I think, Andrea, there's no danger, I think, of vehicles getting lost in this discussion. I think people who advocate for not using vehicles lost that argument a long time ago, and a big part of this problem we face now is that the desire for vehicle use is just too successful, and motorization is happening far too quickly over too short a period of time. Probably
Not in rural areas.
but not in rural areas, but it'll come. And if you're looking at what a big part of the post-2015 discussion, a big part of a lot of donor portfolios is about rural roads and rural access. And it is coming, and we're already finding that there are problems, for example, with motorcycle injuries for villages in remote areas. So it's a problem that's going to come, and there's nothing we can do to stop either the development, and I think it would be right to try and stop development. Development is important for all sorts of reasons. What we need to make sure is it happens in as safe and sustainable a way as possible.
Gentleman over there. Sorry, he was just before you, I think. Yes, please.
Yes, Stephen Young from DFID. I was surprised in a way when in the data that was presented there wasn't a sort of disaggregation of urban and rural more. I mean, I think, we live, as you know, in an urbanising world. We don't need to say that. But it seems to me the characteristics of disease, the characteristic of injuries, speeds, all of that stuff is going to be very different between urban and rural. And it seems to me maybe we're missing a trick in a sense if we don't disaggregate a little bit more in terms of the sorts of solutions that will be appropriate.
Yes, Aaron?
Well, and perhaps Katie from IHME might want to speak to this, and Kavi as well. From the air pollution side, we can actually estimate, and did estimate, population distributions of exposure to particulate air pollution by urban and rural location on a global scale. What's missing, the piece that's missing to enable us to estimate burdens, health burdens, by urban and rural location is the lack of urban and rural, separate urban and rural mortality rates. So in order to make these burden estimates, you need three things. You need to estimate, like for example, for air pollution, you need to estimate the exposure to air pollution. You need to have information from epidemiologic studies that tell you about the risk of that exposure, and then you need to apply those to the mortality rates. The mortality rates at this point, although I think this is going to change, I think this will probably change quickly as a result of the work of IHME going forward. But up until this point, there have not been separate mortality rates by urban and rural populations. We know they differ, and so we've been loath to make separate burden estimates for them. So that's why.
Katie?
I just wanted to say that you're absolutely right, and we need this information to make effective policy. IHME is working, global burden of disease researchers are collaborating with different country governments to look at health at the local level, and this is a critical question. But also, across provinces and cities and rural areas, how do the health outcomes differ? But I just wanted to say you're absolutely right, and we want to get to that point.
I might just jump in with a quick comment, but from the road safety injury side, again, the question is how are you going to locate on a network so the death and injury kind of focal points so you can make an implementation of countermeasures, particularly on infrastructure. And again, across the board, I think it's okay to generalize, the ability of countries to do this is still systematically very weak. And so we've been investing, as you know, through the Global Road Safety Facility on tools like rating roads for safety, the type of proactive approach, and I'm sure my colleagues from International Road Assessment Program would be able to comment. In fact, I see Rob, your hand was up earlier. But most of the death and injury in any given network can be located in a small percent. The social costs of overall death and injury is usually targeted in a few very specific areas. But the capacity, the ability of developing country agencies to really locate that is somewhat limited. So again, it's a question of transferring the knowledge both on the engineering front and on the design front. But in the meantime, we have to be able to do something about that. And that's right through the bank, through projects using IRAP, for example, we have developed tools that allow us to locate these targeted areas and suggest interventions for the government to implement through our projects in a much more focal way.
Okay, was your point on this, or shall I'll come back to you. This lady then.
Thank you, Sheila Page. It's really rather following up on Saul's intervention of what are the policy implications of this, because there's very little about choice in anything that any of you said. I mean, the idea that one should use the cleanest technology is a meaningless statement. One has to use, there are choices about what one uses. There are choices about how much one puts into, so far one's really been thinking of, we're going to build a road, it is desirable to build in a safety system to go with it. But the policy choices come much further back. The policy come, as someone else pointed out, on the employment side, on the structure of the economy side, on other forms of transport, on all sorts of things. And none of this has really come in here. I mean, when it's been treating the road transport sector as if it were a closed garden that within which things happen and should be happening better, but which isn't really impinging on or being impinged on by other choices. So I really would like something on the policy side of this. And closely related to that, a very specific question to Katie, when you're doing your adjusted years of against life expectancy, is this against life expectancy in some global sense or the particular country? Because the life expectancy in a country that's already been seriously reduced by HIV/AIDS, in a sense you risk saying that traffic deaths don't matter because they would have died anyway. So I wonder how you tackled that. And on the community severance point, it's also community bringing together. It doesn't just allow migrants, roads don't just allow migrants to go to work. They allow migrants to keep in touch with their families. So that there are all sorts of other effects of roads which weren't in any of either your diagram or your analysis.
I think probably I should have asked you to give your name first.
I'm sorry, Sheila Page.
Lovely, thank you. Right, we have several points there. Yes, Katie, do you want to go first?
I just wanted to jump in really quickly on that clarification. I'm glad you brought it up, and 5 minutes of a presentation was not quite enough to get into that. But GBD at its core is quite egalitarian, because it's looking at if a person dies early, that's compared to the highest life expectancy that we observe in that person's age group. So if you die in Nigeria, it's not based on what the highest life expectancy is in your age group in Nigeria. It's based on usually how long a woman in your age group in Japan could expect to live, because those are the people that tend to have the highest life expectancy that we see in the world. Does that make sense?
No, actually, it's not the choice the Nigerian government is making. The Nigerian government, they have to decide whether to do something, thank you, about HIV/AIDS or about road traffic deaths. And if you're measuring it against a Japanese woman, that doesn't seem terribly relevant.
Well, that's we're
I mean,
saying that everyone
it shows the cost in some abstract sense, but it doesn't show the actual decision which you have to make of, do we improve road safety, or do we improve other types of health, or do we do all the other things the government might want to do?
Well, I think it's actually quite relevant, because what we're looking at is we're saying everyone, regardless of where you live, what your gender is, you deserve to live as long and as healthfully as the person that has the most healthy life and longest life in the world.
Can I jump in?
Yeah.
Yes.
It's fantastic that you're asking these questions. Unfortunately, 5 minutes in a tiny report, that's what they allowed us to write. We can only really talk about what we think is the most important thing. And I completely agree with you. It's biased by the 30 years I've lived on this planet, but the hundreds of years of thinking that has evolved, which was drilled into my head by the people who taught me. Having said that, we do talk about all of the issues you're raising in our classrooms. You know, I'm a professor at a university, and we have all of these discussions in depth. The important point that you must take away from this is that you are talking about distal risk factors, which I think are the most important thing. However, we've been living in a world where we weren't even, the road safety people weren't talking with the air pollution people. And we're still not talking with the physical inactivity people, even though in my department, we sit right next to each other. We had no framework for doing that. This is allowing us to break down exactly the barrier you're talking about. And Aaron and I have been just talking about how we want to move over to distal risk factors, think about exactly the sorts of things you're talking about. It's just not been possible for us to do it yet. We've got funders in this room. I hope they'll fund that kind of work.
Okay, we had a couple of... Yes, go on, Aaron.
I also want to thank you for your comments. I thought they were great. I want to clarify perhaps something that I said that wasn't clear. I wasn't saying that people should do things. What I was saying is that there are some promising developments in engines and fuels and regulations on national and regional and global scales that, if implemented, really do hold some promise for cleaning up air pollution from road transport. I think they really truly do. With the example, I mean, the United States has done this successfully. So Europe has done this. So, well, we could talk about this. I think there's a very strong record that says that it has. So I don't want to be misunderstood. I wasn't saying, you know, people should buy clean, you know, diesel engines or something. I think there is it's the responsibility of industry and governments to promote and make it possible for people to adopt these technologies now that they are available. So that's I'm sorry if I didn't convey that accurately. I also agree with both what Kavi said and what you said about the fact that there are complex relationships here that we haven't gotten into. I would give you an example of one of them. Frankly, just occurred to me. It should have occurred to me earlier. I put up a slide that looked at the proportional contribution of road transport to total PM pollution in cities in East and South Asia. That was the blue slice. Well, there was a big purple slice. The purple slice is much bigger. What's purple? Largely coal. Now, coal is what's necessary to produce cement. It's necessary to produce steel, which is what's necessary to build infrastructure. And you know, China and India are going about this in a very aggressive way. So there's lots of trade-offs here. If you look at it, as I unfortunately tend to do from an air pollution-centric point of view, it really comes down to multiple sources. And in terms of the burden of disease, it evolves, and I'm obviously not a policy person, but in terms of the burden of disease, it involves looking at those hopefully together and considering policy options that reduce all of them in a rational way, whatever that may be. Frankly, the global burden of disease framework is the only framework I know of that's going to allow us to be able to do that. We're not quite there yet, but we're making plans to do that, to address all of these sources. So thank you for making me think of that.
Right, in fact, I have a gentleman over here who's been waiting patiently. I have to keep looking over here because coming back to you.
Thanks very much. Rob McInerney here from the International Road Assessment Program, IRAP, and just picking up on Mark's lead in there. What we do know in the road infrastructure side of things is that more than half of the deaths will happen on less than 10% of the roads. What we also know is that a one-star road will have 4 times the death rate of a 3-star road, for example, and that we're seeing investment returns of 10 to 1 or more from that investment in road infrastructure, bringing that up to minimum 3-star standard on these high volume roads where large numbers are getting killed. My question for the panel, because I think this is such an important report, because the challenge we find, and I think when you look at what is the cause of this gross underinvestment in road safety globally, is it's because the costs are in the health sector and the solutions are in the infrastructure sector or vehicles or in the way in which our behaviours are managed. And it's that barrier that has led us to this global epidemic that we're sitting on at the moment. It's that barrier that has to be removed if we are to see a sustainable development goal with a road safety target become part of what shapes the next 15 years. But amongst that will be that challenge of how do we remove that barrier between those where the costs are and those where the solutions are, and whether any of the panellists have any ideas as to how we can help break down that barrier.
Right, who'd like to deal with that one? Kavi?
Well, I was trying to say that inarticulately before, that the health sector is best positioned to explain that the costs are massive. They can help make the business case for road traffic injuries being a big problem, a case that the transport sector really struggles to make. You know, the transport sector sees infrastructure as something that they're funding because governments are asking them to build roads. But the health sector has to step up and say, building roads of a certain type lead to a very large impact, an economic impact, in addition to the social impact, which we're doing fairly well with ALIs now. I think that we have to get to the point where the governments are demanding that their roads are built well. And that's going to come with the health sector engaging in countries, reminding them how big this problem is, encouraging them to build certain types of roads, so that the transport sector that can then gets engaged with a mature sort of government on the other side. And by mature, I mean mature in a certain developmental paradigm, rather than the developmental paradigm of let's build roads because it's good for economic development.
Mark.
Thanks, Rob and Kavi. It's an important question, Rob. As you know, we've been trying to figure out how to break down this barrier for a while. But again, two things, picking up what Kavi said. I mean, we are trying to encourage some sectors that we haven't really talked about here today, the NGO community, for example, in countries, to make the advocacy case. I mean, largely civil society has been a relatively silent voice, partly because they don't have an avenue within their own countries to have their voice heard. We know there are very active people out there trying to talk about the poor infrastructure quality, the inability to effectively walk to school, how their children are at harm. And so funding for the NGO community, and I know there's an NGO alliance, of course, that was launched a short time ago around road safety, is a very important thing. It's also an issue, again, picking on Kavi's point, on how we can get countries to prioritize this, but show them that the return of an investment on road safety is important. But again, each country is this is such an individually specific issue for each country involved. I think it's the job of development banks, the job on people in this panel, and hopefully, as we've shown you through this report, to explain a pathway for countries to begin to systematically understand where exactly they are in the spectrum of managing this issue. You can certainly work on road safety even in a post-conflict country situation. You can work on road safety in a middle-income situation. And as we found, even in some of the best performing countries like Sweden, there's always room for improvement, and they are the best. But this is a continual issue. And so you reinforced this idea that a lot of the death and injury is located in a small percentage of the network. These are the type of metrics that we need to be able to explain to countries and show them that there are cost-effective solutions that in the long term save lives, promote economic development, and they can start. They don't really understand how to start and how to do it in a sequenced way, and that's really the challenge here. And finally, the opportunity in 2015 with the midterm review of the decade, with the next global ministerial meeting, I think we actually need a bit of a rethink around the global plan, around the pillar approach, because a lot of countries see this and they think, well, if I'm taking care of one pillar or another, I might be solving the issue. And again, to countries who are trying to break down the barriers between health and transport, they need mechanisms to do that. They need to be able to get their hands into it for a couple years at the project level and begin to really understand from a management perspective how to tackle it. And again, pointing towards development banks as one of the key interlocutors to make this happen, I would hope we're going to be, going forward, part of the major solution for reaching the decade's goals.
The gentleman over there.
Hi, David Harrison from the International Road. I had two questions. One is, what scope do you think there is for multilaterals that fund infrastructure, especially the World Bank, to go beyond persuasion and maybe slightly adopt a stick approach and press for conditions as a condition of funding? And secondly, a separate question, we're doing an inquiry into disability, and I wondered whether the study had come up with any figures for the extent of disability caused by road transport.
Yeah, the question on conditionality, essentially making it a safeguard, is one that comes up frequently. Again, from our perspective, what we've done at the bank is make every transport project that is going through the board, ensure that it has road safety components looked at. And different development banks have different policies currently. One of the things that we are doing is coordinating across 7 other multilateral development banks, precisely understanding where they are on the issue with road safety, how they're implementing it, and how to scale up their internal capacity and how to scale up their country dialogue. The conditionality issue is one which hasn't gone forward past a certain point, but what we can say, of course, is that we are farther along in road safety than we ever have been in the development bank community, thanks to the work of the last 4 or 5 years in particular. And we need to be able to go forward in a way that makes sure we continue this progress. And of course, there are other actors out there now. China, as was mentioned, building a lot of roads in Africa, for example, and we need to be able to bring the China Development Bank, for example, into this community to have discussions. But again, when they offer this to governments in Africa, it's a very enticing thing to get a new road, which inevitably will probably encourage high-speed usage and will inevitably lead to additional deaths. So the international community at large needs to have a very mature discussion around this. And again, I think 2015 is the time to really reassess during the global ministerial exactly how we go about making this a stronger internal requirement for all of the banks.
Anybody on the disability issue? Gavi?
The short answer is yes. The longer answer is that the way the global burden of disease measures health loss is through the metric disability adjusted life years lost, which is a sum of the amount of health loss due to early mortality, dying at an earlier age, plus the health loss from living with disability. So, and that's a weighted health loss so that you can compare death with severity of disability. So for every disease, we've computed DALYs, and this report talks about the combined DALYs, the combined health loss, including disability, from injuries plus air pollution. And so if you look in the executive summary, it points to 79.6 million healthy life years lost due to motorized road transport, some of road traffic crashes, as well as air pollution. And that's, we compare that with the burden of the leading health causes. And the first table, which Mark had included in his presentation, table 1, on page 22, shows you that comparison. And it's, I think, the 5th or the 4th leading cause of health loss when you include both mortality as well as disability.
Okay. Did you want to say something? Yes.
I just wanted to add really quickly, if you are interested in specifically looking at disability, you can go on our website and look at our tools, and you can look specifically at years of life lived with disability, YLDs.
This is the website of the Global Burden of Disease.
Yes, ihmeuw.org/GBD.
You can
yes,
also go to the
sorry.
back of the report and find years lived with disability from road traffic, from road transport, years lived with disability by country. There's a big, long, complicated table back there that should give you everything you want to know about that specifically.
Figures 16 and 17 as well.
Mark, you wanted to?
No, it was just to
Okay.
alert you to go.
Fine. Thank you. Yes, please. Thank you.
Gary Forster from TransAid. A question to policymakers and health economists alike. And I speak as an organisation which implements sort of practical road safety initiatives on the ground in some of the countries we've been talking around, and specifically around building the capacity of driver training institutions to deliver high standards of driver training to truck and bus drivers. Now, measuring the outcomes and outputs of our work is incredibly difficult, just looking at outcomes and outputs. Mark, earlier you mentioned that one of the recommendations of the report is the systematic measurement of health impact of road projects. Now, if we look at some public health areas, they've done a lot in linking specific interventions to DALYs averted to give a cost per DALY averted. This has helped mobilise funds for specific interventions, and arguably the expanded programme on immunisation is an example of that. I just wanted to get your opinion on where you think the road safety sector is along that path of being able to measure the efficacy of interventions and perhaps put a cost per life saved to them.
Anybody want to take up that challenge?
I'll start from a sort of non-researcher point of view. I think we're way back down the track, and I think a big part of the problem that we have in persuading people to get behind this agenda is a lack of evidence of the problem in terms of data, but B, the efficacy of solutions that we're proposing. There's a lot of rich data for the developed world, and there's a lot of good work, as Mark said, that's been done on safe systems, and you know there's a huge amount of data which shows it works. But when you get down to a low-income country or middle-income country level, and you're looking at projects, it just isn't there in a large number of cases. And there's some, and it's sort of catch-22 because you need to take things to scale in order to really be able to measure them properly. But if you haven't got the funding to take things to scale, then how are you going to measure them? I think that's why something like the Argentina project is so important, because that will show what can be done when you're investing $50 million. You know, what are the injury outputs? It's why what Vietnam has done with helmets is quite important, because you know, when you've changed the whole population's behaviour and you've enforced it and you've increased helmet use overnight from sort of 30% to 90% in urban areas, there's going to be some injury data that you can measure. But you know, correct me if I'm wrong from the research side, but it seems to me that that is few and far between.
Yes, Aaron?
Yeah, in the area of air pollution, there's actually been a considerable amount of effort spent over, you know, quite a while to estimate what the benefits of actions taken to improve air quality have been, not necessarily focused on road transport, but more generally for air pollution. US EPA is mandated actually to make those assessments in terms of the Clean Air Act and titles of the Clean Air Act, and they've shown that they're quite the cost-benefit ratio is very favorable, probably the most favorable for any set of regulations in the United States. My institute, the Health Effects Institute, has had for a number of years a program that we call the Accountability Program, which is essentially funded research trying to measure directly what the health benefits are of actions taken to improve air quality. And we've funded studies of the London low emission zone and congestion charging scheme, and as well as efforts to take sulfur out of fuel in Hong Kong and a number of other things, and the coal ban in Dublin that was in the 1990s. Trying to make direct estimates, again, of the benefits that come from actions taken to improve air quality. Overall, you can measure some benefits, but it's very, very hard to do. These are very difficult studies to do directly. So there is some evidence that taking actions to improve air quality, and again, this is not necessarily focused on road transport, actually really do produce health benefits. But it's very difficult research.
Yeah, just very
Kevin.
quickly, I completely agree with Saul that we are in our infancy in understanding this. I mean, you know, causal pathways we somewhat use by proxy is what we know from developed countries. I mean, you know, if we're looking at sort of big priorities around road safety, I mean, we know infrastructure safety can have excellent returns on investment around safety, but there's higher upfront cost to do that, and there's sort of a longer period in which to measure that. Enforcement can have excellent short-term gains for safety, but of course we all the requisite issues in capacity in developing countries, corruption issues, et cetera. And I would venture to say that enforcement is probably the most underserved area right now within this UN Decade of Action for Road Safety, and certainly one that we need to look at scaling up. On the vehicle safety side, and Sol can probably touch on this a little more with a little more specificity, we are actually seeing some very interesting results coming out of the global ENCAP program, which essentially star rates the same vehicles that are being produced in Western countries and developing countries, or through their own domestic manufacturing base. And as what you can imagine, the results that are coming out, essentially what we have are vehicles that have substandard safety features carrying some of the same name brands. So Latin ENCAP, for example, a Latin American version of the star rating program under ENCAP, and most recently a launch in India, has produced some shocking results. But we are, correct me if I'm wrong, Saul, we are seeing some sort of immediate response, both good and bad, from the auto manufacturers to these tests.
Yeah, absolutely. I think it's a good example of a program which has an immediate impact, because if you can persuade car manufacturers to improve the quality of the vehicles they're providing, then you're going to have an immediate effect on death and injury. What we're seeing, we're at the stage now with Latin ENCAP where we're seeing zero-star cars which are 20 years behind European cars in terms of their safety quality and equipment, but cost the same and are marketed the same, being improved to 4 or 5 star level. And what we don't have yet is injury data which will show the impact of that. But the experience we've had in Europe and elsewhere with ENCAP programs is that the injury data follows quickly behind, and it is it's very impressive.
Well, I'm aware of the time, because 3:05. Kevin, did you want to wrap up? It's been a really interesting discussion, I think, hasn't it?
It has been just to maybe I will wrap up.
wanted to
Just
comment
a really
anyway.
brief reflection
Please.
first. So, You know, I mean, it really strikes me that we have an issue in how we communicate and think about the problem and engage with policymakers, because, you know, what this is describing is a really systemic development challenge, you know, just in terms of numbers. You know, the 1.7 million deaths, is, as you said, is on a par with HIV/AIDS or exceeding HIV/AIDS in many countries, and many infectious diseases. But when you look at those diseases and the policy discussion around them, you've actually got ready-made solutions. Well, not ready-made, but you know, you've got viable and affordable solutions. And we've been reflecting this in the discussion today that, you know, we have a lot of presentations setting out the massive scale of the problem. When it comes to what can we do about it, we've got a couple of roads in Argentina. I mean, I'm not dismissing it. We've got cost-benefit work. And I've never met a finance minister in my life who looks at cost-benefit. I mean, the finance minister looks at the real cost. As in, you know, what is this going to cost me in the next budget cycle? And the challenge that we face, I think, is to go beyond projects, which I know is what we're trying to do, and to think about, you know, if you were changing the system to get from where we are to somewhere better, what are the measures you need to put in place? And in some ways, I don't think the Swedes help all that much on this. You know, we have a bit of a tendency in development. Like we look at the best performer in the world. You know, water is the Murray-Darling Basin. So, you know, there are a lot of Australians all over Ethiopia telling people how to manage water resources. Here we've got Sweden. And of course, no one in Africa is going to make the transition to a Swedish-style regulatory system, as we all know. And we know that making small improvements in regulatory systems, in police enforcement, you know, in driver training, and all these things, I mean, they're tough things to do, and they're costly things to do. And actually, aid donors don't prioritise this as an issue. I mean, the level of aid for road safety, I think, is in the region of 25 to 30 million a year. You know, for an epidemic that's claiming 1.7 million lives. And then we're sitting here and saying it's a major priority. I mean, it's not. So I think the first question is, you know, how do we make, as you said, Mark, how do we make governments in countries see it as a priority? And that's about a domestic political challenge. But we've clearly got a big challenge with the global donor community as well, because I think aid agencies, for the most part, I mean, they say the right things, but the money doesn't come behind the principles from what I can see. So maybe I should end it there. And in terms of wrapping up, should I wrap up?
I think if you would.
Okay.
Yes.
Well, look, just to say really a huge thanks to everyone, because they were great presentations across the board. And I do think, you know, we're all grappling with a really tough issue here, but it's fantastic that we've got such good minds working on it, and that we've now got such I think a helpful and constructive report to guide us going forward. So with that, I'll close. I'll recommend everyone goes and looks at the FIA Foundation site, because there's some great material there, including this side, I imagine.
It will be shortly. Yeah.
Will be there shortly. See, I prompted that for you.
And the Global Road Safety Facility website as well.
And the Global Road Safety Facility website too. And so thank you very much to all of you for coming. Thank you.
Thank you.